Hi, and welcome to Apt in Act, the YouTube channel where I answer your questions about acceptance and commitment therapy and contextual behavioural science. My name is Jim Lucas, and I'm a behavioural therapist and a peer-reviewed ACT trainer. In this episode, we're exploring the question, why does ACT not focus on symptom reduction? When practitioners discover acceptance and commitment therapy, they're often surprised by the message that symptom reduction is not so significant. For many years, psychology services have used self-report measures such as the PHQ-9 and the GAD-7, which focus on specific so-called symptoms of depression and anxiety. These tests and many others ask about thoughts and feelings, and case management supervision pays close attention to changes in these scores. RCTs in cognitive behavioural therapy tend to use symptom reduction measures to show how effective a treatment is for a specific problem. Cognitive therapy uses the principle that if a person rationalises their thoughts, then they will start to feel better. In other words, there's a culture of symptom reduction inside psychology, which I think is why newcomers to ACT are often puzzled by the idea that symptom reduction is not necessary. So what does ACT focus on instead? ACT works by increasing psychological flexibility, which is a combination of 6 interrelated behavioural processes that are organised into 3 pillars commonly known as open, aware, and active. Research shows that when you build psychological flexibility, the quality of a person's life improves and the symptoms of the so-called psychiatric disorder also reduce. So why don't we focus on symptom reduction as well as psychological flexibility? ACT is concerned with developing science that is adequate to the human condition. Despite the advancements in psychological treatments for mental health problems, there are multiple issues why both the current psychiatric characterization of disorders and the prioritization of symptom reduction. The DSM and the ICD-10 are the chief diagnostic tools in psychiatry, and they dominate the way professionals think about mental health problems in the UK. Unfortunately, the classification of issues into disorders is not a scientific process. It's merely done by consensus among psychiatrists. Therefore, if a psychiatrist says that you have depression, that's only true because they say so. There's no blood test or biological process that can support the diagnosis. Have you ever heard of a person receiving more than one diagnosis? Sadly, it's common, and it's because the process is subjective rather than objective. Medicine, by comparison, is a more objective process with clear biological markers for disease. You cannot measure mental health problems like that, and so we cannot rely on the psychiatric system of diagnoses to provide us with clear information. Practitioners need to know what keeps a problem going because it allows you to target the specific processes that are not working. And the ACT model of psychological flexibility attempts to give you and your client a practical framework. Experiential avoidance increases suffering, and research studies using ACT show us that experiential avoidance drives up anxiety and depression. Avoidance is the process of pushing away, trying to get rid of, or escaping thoughts and feelings. And it shows that the more you try to do that, the more distressed you become. So it wouldn't make sense if ACT suggested you focus on doing more of that. It would only make the situation worse, would it not? ACT teaches skills in mindfulness and acceptance that do help with emotion regulation. However, they are only tools to help you get better at looking after yourself and other people. The main aim in ACT is to get you moving your feet and to live fully in your experience. That's proper well-being, living well. It sounds simple, but in reality it's far harder to do because we're often lost in our minds worrying, analysing and overthinking. And we adopt and follow the rules for living that usually function to drive you away from discomfort. And we run away from feelings that we don't like. Many people arrive at therapy wanting you to help them be less anxious or depressed. They just want to feel happier and more relaxed. However, these goals are vague and don't tell you what a person wants to do with their life. Well-being isn't merely the absence of anxiety or depression. Well-being is about building patterns of health and wisdom. ACT helps you to make your life bigger instead of making the problem smaller. And it just so happens that as you grow, This obstruction inside you gets smaller proportionately and it loses its power. It no longer fills up your entire experience. Studies in well-being show that reductions in anxiety and depression don't correlate well with improvements in quality of life. If you just focus on bringing down these symptoms, then you aren't helping a person as much as you could. Plus, fear, disappointment, hurt, guilt, and anger are part of life. You can't grow and not have these feelings. One needs to be better at navigating these emotions and to keep moving. As Winston Churchill said, if you're going through hell, keep going. In ACT, our aim is not to help our clients feel better, but to help them be better at feeling. It's an important distinction, and hopefully one that captures the spirit of psychological flexibility. Thanks for dropping by. Please comment below if you have any related questions and click subscribe to get updates about new videos. See you next time for more lessons on how to get apt in ACT.